Hey, good morning, Facebook. It's kind of early. Hope you're all having a good Friday. We're coming up on the 4th of July, heading to work. 4th of July weekend, heading to work this morning. I am not driving. My lovely wife over there is actually driving, so trying to be safe here while we're filming. I didn't have time last night when I got home to do a video about this, but I wanted to make sure that we reached out to our followers today, and I wanted to go over something that was pretty important. I had a colleague of mine. She's a doctor. She's a psychologist, actually, Dr. Linda Lagerman. Shout out to you, Linda. She had showed me this book that is what's called the Diagnostic and Statistical Manual, basically for psychiatry. So, what it does, it goes over how you can be diagnosed with mental disorders. Now, I'm not here to argue that people struggle mentally and have stress in their lives, and there are definitely issues out there that people have. But I wanted to show you how the pharmaceutical industry, along with doctors, in this case specifically psychiatrists, actually not even psychiatrists, you're a pediatrician, if you're a mom out there, this is how the pharmaceutical industry is trying to make diseases out of everything, and as a result put you and even in this case your kids on medication. So sorry, I'm trying to make sure I'm watching where I'm going here, even though I'm not driving. A little bit of a control freak, I guess. So I'm going to show you this book, and it might show up backwards on Facebook here and the camera, but it says DC 03-R. The R stands for revised, and what this is this is the Diagnostic Manual for psychiatric disorders for children between the ages of 0 and 3. Yes, I said that correctly. It's diagnoses that the psychiatric industry, in order to sell drugs, can put your children on 0 to 3-year-olds. So an infant, like just firstborn, right? So they can be diagnosed with a disease, with a mental disorder, between the ages of 0 and 3, and as a result be given medication. Now, what I want to do is I want to read you one of these, page 35, if you care to pick up this book. Page 35. All right, now, you got to get how horrible this is, all right? This is mind-altering, life-altering medications that can be prescribed for your 0 to 3-year-old. Page 35. I don't know if you can see that there, sorry. Number 510, sleep onset disorder. All right, sleep onset problems, I'm going to read it to you. Sleep onset problems are reflected in the time it takes a child to fall asleep, the child's need for the parent to stay in the room until they fall asleep, and or the child's need for reunions with the parent, i.e. the parent leaves the room and comes back in response to bids from the child. Diagnosis of sleep onset disorder requires that there be, all right, you got to get that, all right, this is horrible. It requires that there be significant difficulty falling asleep for at least 4 weeks with 5 to 7 episodes per week. That's what it says right here. So, how many of you have been parents out there? Comment below. I really want to hear this. Comment below. I want to know how many of you parents out there have ever had a child between the ages of 0 and 3. Now keep in mind, if it goes beyond 3, I'm sure it's even considered a bigger disorder. But between the ages of 0 and 3, who would not stay in their bed at night, or would keep calling you back into the room because they wanted a glass of water, or now they have to pee, or something like that. Understand that the pharmaceutical industry, in cahoots with the psychiatric industry, based on the diagnosis in this book, you can read it yourself, buy this right off of Amazon, don't take my word for it, are trying to put your children, your babies, on what is potentially life-altering medications. This is disgusting, all right? Now, last week I talked about how the American Heart Association has come out and said coconut oil is bad for you. And just a couple years ago, they had endorsed Cocoa Puffs as being healthy for the heart. Now, you can go on and search that information for yourself also and find out that the American Heart Association, in order for something to be endorsed, the company had to pay the American Heart Association to endorse it. So General Mills actually, just because they wanted some extra sales, paid the American Heart Association money so that the American Heart Association would endorse Cocoa Puffs. How absurd is that, right? So the American Heart Association, who's supposed to be looking out for your health, who you donate money to in order to prevent heart attack and heart disease and things like that, come out and they say, based on money alone, that there's something that is extremely unhealthy is actually good for your heart. So it's just a money grab, right? Well, based on this book here, the same thing is occurring with mental disorders. You can be diagnosed. Pick up the DSM-5. It's called the DSM-5, and that is the Diagnostic and Statistical Manual for Mental Disorders for Adults. If you pick up that book, you'd find out that every normal behavior ever known to man, has been classified as a mental disorder for which you can be prescribed a medication. This is about selling drugs and controlling the population through these medications. It's not about you being healthy. It's not a healthcare system. It's a sick care system. Now, in light of all that, what can you do? All right. So if you have an issue, a lot of times you have to find the right provider to be able to help out your child. I can tell you that your child between the ages of 0 and 3 does not have a mental disorder, for crying out loud. They don't have a mental disorder because they want to get up and be with their parents, or they won't go to sleep that easily. I have 4 children. None of them, they all could have been diagnosed as having a mental disorder based on sleep disorders of a 0 to 3-year-old. They could all be diagnosed with a mental disorder. It's just absurd. It's disgusting, and it's I could use some other choice words, but I'll refrain. So what can you do? Find a provider that is going to be able to tell you how to feed your child. Dr. David Perlmutter is a neurologist who talks a lot in books that he's written. Search Dr. David Perlmutter about how the diet affects the brain and the gut. Your gut is extremely sensitive. Your brain is extremely sensitive to what happens in the gut. Chiropractic care can help these types of things, help your kid calm down. Things such as lack of proper magnesium in the diet can keep a child from calming down and having good sleep. There's lots of things you can do. What's the neurologist, the psychiatrist's name that you follow? Dr. Kelly Brogan. She's a women's health psychiatrist. You can follow her on Facebook to search her information. She can read her information to give you lots of ideas on how to change your diet, change lifestyle in order to prevent stress and brain-related issues, or what we think are mental-related issues, which are almost always diet-related, gut-related problems. They're almost never a psychiatric issue, almost never. It's just horrible that all these medications are being prescribed, and it needs to stop. So we're almost to work now. Hope you all have a great 4th of July. If you need anything from us in our clinic, our functional medicine provider, it can certainly help these situations. Now, we don't see small children, but you do need to be aware that if anybody's suffering with psychological issues, work on the diet. If you need guidance with that, please don't hesitate to give us a call. We're happy to help. The number at the office is 615-225-9100, or you can certainly hit us out in Facebook messages here. Please comment below if you have any comments on this subject related to this book and the information that I gave you. I'd love to hear about it. I'd love to hear if anybody out there shares my ideas on the fact that it's absolutely retarded and ridiculous to label a 0 to 3-year-old with a psychiatric or mental disorder. So again, have a great 4th of July weekend, and we'll talk to you next week.